I'm Muir. I've been a public health professional for 40 years, and I currently am working for the QIPP Right Care programme. Westminster Abbey is a fantastic building, and these cathedrals, like St Paul's Cathedral, and I know Westminster Abbey is not technically a cathedral, these were the great buildings of the Middle Ages. In the 19th century, the great buildings were railway stations, like St Pancras. In the 20th century, if you go into a city, the great buildings are hospitals. But the 21st century is not the century of the hospital or the health centre, important though they are. It's the century of population health care. We in the QIPP Right Care programme have been absolutely focused on this since we started. And we've been working with public health professionals in these difficult times to shape the ideas about population health care. We believe public health professionals have a very important role in creating population health care. Now, what do I mean by that? Well, let me ask you some simple questions. Is asthma care better in Somerset or Devon? Don't know. Is epilepsy care better in Liverpool or Manchester? Don't know. We don't know that for any condition really in any country. But we have to get that right. So population healthcare would mean healthcare based on the right population size for the particular problem, not necessarily the same size. We see healthcare delivered in this way partly through commissioning, but it will need missionary drive by public health professionals, particularly those with an interest in better healthcare public health, which we call the third arm of public health. There may be a different title for it. The QIPP programme has been working during the period of uncertainty. About 6 months ago, we set a date, 9th November, and that's a date when we're going to produce some answers. We'll be starting to hand over from the Right Care programme to Public Health England. So I'll be summarising the work we've done in Right Care. Duncan Selby will be speaking, and the newly appointed directors will be there. We really want people there who have a tradition and history of working with the NHS. We'd like trainees to come because there are going to be jobs in this field. There's going to be work in this field. How it will shape up, we're not quite clear, but we will be clearer on the basis of work done by Solutions for Public Health by that time. So, Queen Elizabeth Conference Centre, opposite Westminster Abbey, new building, perhaps not particularly attractive, but it symbolises the fact that healthcare is an idea. We're moving away from the idea of hospitals and community. We're moving away from primary and secondary care to healthcare for populations, with self-care, informal care, generalist care and specialist care. That's population healthcare. So we look forward to seeing you at the conference.